Hello, Miss Yoshi. Thank you for coming in today. And hello, Mom. So what's actually going on, that little scaly portion on the back of her head, it's actually tinea capitis. It's basically the essential of like athlete's foot ringworm, but on the head. So it's the same thing that causes it. And we do need to treat this, and it's not going to be with your standard antifungal shampoo. It's going to be with an oral medication just because it could lead to baldness, which we don't want because you have the most beautiful hair. So what I'm going to give you guys, if you want to change it, there's a couple different options, but Fulvin ultra micro size. It's going to be 250 milligram tablets. And essentially, she's going to have to consistently take this every single day and appropriately for this to actually be effective. This one will be a shorter course. The regular one, it would just be one tablet, but it would be for like 8 to 10 weeks. In comparison, this is going to be 4 to 6. So 2 tablets with a fatty meal. But I usually recommend, like, if she has eggs in the morning, or maybe she eats an Uncrustable for lunch, and I'm going to need you to store it somewhere out of moisture, out of heat, just to preserve the medication. And it's actually very good, effective medication. It will basically go in that hair follicle, and it's going to make it resistant to all of the things that causes this. It's going to make it unfavorable for it to grow. So if you miss a dose, please do not double up on it. Just wait till the next day. If you're really concerned, you can give me a call. Some things to look out for, some normal things is going to be your nausea, your vomiting, your diarrhea. If she just acts like she kind of has a bad flu, like general malaise, maybe a little bit more tired than usual. She's just a little bit more confused. Also, if her urinary habits change, if she's going pee too often, or it looks like a different color, give me a ring. Look out for those white patches on her throat too. Miss Yoshi, if you start to feel any numbness or tingling, little pinpoints in your feet, in your hands, Mom, you're gonna have to call us, okay? Now it's emergency room time. Ignore my office when we start to see things involving an allergic reaction. Any shortness of breath, difficulty breathing, the wheezing, the hives, those that are the scary things, and go to the emergency room. Additionally, there's like a rare drug reaction that could happen, and I'm telling you this information not to necessarily scare you, but to make sure you're the most appropriately prepared if this were to occur. So if you see these odd lesions that kind of look like blisters that popped, specifically around her like mouth, nose, go to the emergency room. She's not on any medications that would really interact with this. It does make birth control actually ineffective, and it's not good to take with alcohol. And Miss Yoshi, since you're in 3rd grade, I think we are okay with this. But I do want you to make sure to protect her out in the sun. So this drug can actually just cause that damage to be a little bit more stronger. So just make sure to like lotion her up a little bit more with sunscreen, protect her, wear some extra layers that you might have really usually not worn. Again, this medication, you're going to take it for 4 to 6 weeks. You're going to take 2 tablets every single day with a fatty meal. You're going to know what to look out for, because I'm also going to give you a piece of paper that's going to explain all of the emergency symptoms and when to call me. And I will see you guys back here in 4 to 6 weeks. I'm going to take a little scraping of her noggin to make sure that all of the things are gone, and hopefully it is eradicated by then.